To quote Kelly Lamrock, I act on behalf of all the elected people to make sure that the government bureaucracy treats people fairly and that it gets them the services that they need and that it delivers on exactly the things that you deserve. Welcome back to Health Policy Off Script. I am Matthew Hart from Longwoods. In 2024, Kelly Lamrock, a New Brunswick child, youth, and seniors advocate, released his paper on how it all broke, fixing how the government manages social policy in New Brunswick. This paper has captivated our podcast hosts. If you have signed up for our newsletter, which you can do so by visiting www.longwoods.com, you would have already received a link to Kelly's report. But the link will also be available on our podcast website. I know that today's hosts are excited to get going. So I will hand over the conversation to Stephen Lewis and Dale McMurchy. Stephen, Dale, all yours.
Thank you, Matt, and hello, everybody. Kelly, you sort of know who I am, but I'm a health policy guy. We're doing this to get health policy discourse to a new level in the country. Today, I am thrilled to have with us Kelly Lamrock. I'm 74 years old and a little old to be a fanboy, but I am an unabashed fanboy. I came across Kelly when in 2024, he released a report called How It All Broke. He is the New Brunswick Advocate, and he wrote a report that did a remarkable thing in two fundamental ways. First of all, he took a whole of government root cause analysis approach to declaring why we fail. And secondly, he used language that would be quite at home if the report were next to something written by Jonathan Swift. It is biting, it is satirical, there is sarcasm in it, but it is, as he would put it, appropriate given the scale and persistence of our failure. At the very end of that report, he says, "It's a blunt report because if I use the same language that government reports usually use, people won't notice. I wanted us all to snap out of the routines for a second and really think about what we're doing here." To introduce Kelly, he's been a cabinet minister. He's a lawyer by training. He's worked in international development. He's a Renaissance man in many ways. He's been an MLA. He chaired the Council of Ministers of Education. And following politics, he ran a legal practice. And not, I think, unrelated, he's also active in theater, stand-up comedy, and sports coaching. So welcome, Kelly.
Thank you so much. It's lovely to have a chance to chat face-to-face, Stephen.
So let's dive right into this. Your report is the most unusual report I have ever read in healthcare. And for those of you listening, if you work in the system, if you're a graduate student, if you're a member of the public, if you have to read one report, read this one. And your basic theme is that it broke predictably. That is, in the words of the quality improvement folks, this is a system that fails in exactly the way it does. Was this something that you had had an inkling of when you were, for example, in government as a MLA and a cabinet minister before then, or when you took on this role as New Brunswick Advocate?
Well, it actually did start somewhat by accident. I speak for children, youth, seniors, and vulnerable adults. And anyone who the legislature feels might not be heard in the normal course of debate. And I had done several reports from the child and youth side, which is probably where the background I brought to the job a little more. And we had started a report into long-term care, which suffers from a number of problems and has really reached a crisis point, particularly with seniors who should be in long-term care being stuck in hospital beds, which is destabilizing two systems, really, urgent care and long-term care. What I was saying is a lot of people were coming to me at various points and saying, is this long-term care report really going to change anything? And in the preamble, I started to write a bit about, well, you know, I always seem to yell at particular government departments, but the social departments are trapped in something that doesn't make sense. And I explained it. And after about 4 pages of explaining it, I thought, you know what, maybe this is worthwhile, because there are ongoing problems in government that really are a design flaw. One is that we govern to rules and systems rather than outcomes, that we rarely ask what are the incentives we give people on the front line. Something I've often said to government is, if you want to know what a program's designed to do, don't show me the words by the minister's picture in the glossy paper. Show me what people are evaluated in when they make day-to-day decisions. Social welfare, we can say all we want about how it's designed to increase self-sufficiency or break cycles of poverty. But if your social worker is not empowered to make a decision other than to say, well, your teenage daughter has a babysitting job, that's family income, we have to claw that back. You're not really talking about breaking cycles of poverty, you're talking about compliance. That it's often made for uniformity and predictability rather than innovation, that we don't have any real link between how we budget and what we want to accomplish. And it was really a rant that turned into a report. When I finished, I sent it around and I said, I've just tried to describe this as I might if I were sitting in someone's living room.
So one of the indictments that you make, you sort of said the old quality improvement mantra again, that some is not a number, soon is not a time. They're not even curious about what happened with the expenditures and whether they accomplished anything at all, which is a very almost chilling thing to say. When you were a cabinet minister, did you have the same sort of sentiments? Did you think, whatever we're doing here, it's not working like it should? As a politician, did you begin to gestate these insights, or was it something on reflection after?
I think most people who go into politics do not understand what levers there are to actually make change. In fact, my first awakening, I did one term in opposition and then our party formed government. I was sworn in as Minister of Education at the time. And, it's a nice day. Everyone is sworn in. The deputy ministers come and almost claim their minister and take them home for safekeeping. And the first thing they do is they hand you 3 large, voluptuous briefing books. Like, now they're going to tell me all the things and ask what I want to do. Not really. The first thing you get are 3 books that say, here's all the possible questions you could be asked, and here's what you should say. And this will keep you alive politically, except the trouble is what you say is always defending the status quo. And I thought, that's funny. Like most opposition politicians, I was just elected basically on a platform that some of this is wrong. A lot of systems in government are on a conveyor belt. You get there and the first thing the bureaucrats say is, here's the platform, so this is what we'll operationalize. Now the platform for most opposition parties was written in an office with a few well-meaning MLAs, 6 research staff, and no idea what the actual numbers are, and no briefings from anyone in the system. But that becomes sort of, okay, so the bureaucrats go away and sort of fit all that in. You get books telling you what to say. The budget process is sort of odd. There is no moment where you sit down and say, what are the social problems we need to solve and how do we rebalance it? Usually, look, you get the news, here's where we were last year. Here's how many millions have gone up in terms of just inflation and collective agreement commitments. Here's how short we are. So every department is asked to produce usually between 2 to 10% of what would you cut. And they give you a list, and politicians generally will point at what they think they can politically live with. At no time does anyone integrate. In fact, even the way most cabinets work is you have one committee that works on program design, and then it goes to a budget committee that either decides, okay, we can afford it or no, we can't. Here's the interesting part about that. When you do budgets, no expenditure is tied to here's the result we need to achieve. Why don't you do that? And the answer came back and said, well, because the departments aren't asked to do that either. We always sort of go in with an idea, at the provincial level, healthcare is politically good, education is socially important, and intuitively money in education must pay off something. But no one ever actually ties upstream problems to results we need to get. Let's say, for instance, if you were really planning the education system, what I would want to do is say, right now, interventions for children who cannot read by the end of grade 5 are costing us this much. I believe that if we this year invest in an early childhood kindergarten readiness program, 8 years from now, we should be able to cut that by 30%. There is no bureaucratic or financial way to express that. If you have money and you want to announce an early childhood program, they'll do it. but no one ever asks if it did anything. Maybe it'd be good to let people on welfare share an apartment. But if we allowed that this year, right now we're clawing back benefits, so that would cost us $2 million. However, if I said over 30 years, we've spent probably about $3 billion on social welfare, have we gotten any better at moving people on social assistance from welfare to work? Or has the high school graduation rate of children growing up in families on social assistance gone up? No one could tell me.
Okay, so let's drill into that a bit.
Yeah.
What you propose, do a budget, set your targets, evaluate it. It's very sensible. It's not quantum physics.
No.
And as you point out, there's lots of talented civil servants. Everybody's well-meaning. No one sets out to fail. Why doesn't that question get asked? Why aren't the targets set? Why don't people circle back? What accounts for this incuriosity that you mentioned?
I think in the end, there's no incentive for being curious. So, for example, most politicians are transient. Most of us come not really knowing what in the world we're in for, certainly not with a public administration background. I often say I'd love to have a course on what do ministers actually do, because I learned partway through going, I get it. My job is not to drill down and start telling people how to do their jobs. My job is to identify what needs to change and to incentivize the people on the front lines to do it. If that doesn't come right from political leadership, you never get that discussion of here's what's important. Because there's no funding model to allow you to solve a problem 8 years from now, they're on the hamster wheel. We're out of money right now. This is a tough year. What are 5 things you could do tomorrow to save a few bucks? And now you have to answer that. Or what if you had 40 million more this year? What would you do with it? And so there's no place to do it. And I think after a while, people get numb. And you sit down and it's like, well, it's January, so we start the budget process. It's March, so we have to write the budget. It's June, so we have to get it through the legislature. And there's no place for it. And at some point, I think the other thing that's happened, if we did have strategic thinkers, remember for 30 years, it has been a mantra at budget time, the political talking point. We're going to protect frontline services and squeeze out the fat. The problem is at some point, it's like, look, social workers are essential in their frontline services. Organizing and incentivizing social workers to deliver a result, or doctors or nurses, is also a skill. But we've cheapened that skill to the point I'm not sure there's anyone left who has been promoted based on the ability to do that. So often what you have are civil servants where people are largely promoted on their ability to run the system as it exists, which means making the hamster wheel run on time, not asking where it's going.
People languishing in hospitals who don't any longer need acute care, but you can't get them out, the so-called ALC, alternate level of care days. And you point out that with a government report, we transferred 35 people out of there, and you mentioned that it would take, I don't know, a millennium to get the problem solved. That seems to be an obvious problem. The solution isn't rocket science either. More home care, short stay beds in long-term care, whatever it is. And yet we can't solve that. Now, my question is, despite the superstructure and the whole approach being flawed, can people on the ground solve some of these problems on their own, sort of don't ask, don't tell? Or is it so siloed? Is it so designed to make sure there's no collective ownership of the problem that it's just hopeless without some reinvention at the higher level of government?
A lot of government right now just relies on if something is ridiculous but rule-based, you just hope eventually you scream to somebody high enough they can give the system a kick. Usually a cabinet minister, a deputy, or a legislative officer with a platform like me. So let's take the ALC issue. One thing I cite in the report that is strange to me is there is no process by which before you admit somebody who should be in long-term care to a hospital because there's no space, no one does a review of saying, are there any supports that would allow this person to either stay at home with supports or to go to a less restrictive type of institution like a special care home. The funny part is that a lot of the programs that might exist are incredibly based on silos and they're rule-based. So for example, if somebody needs a chairlift, the program for the chairlift says that your home, to qualify, you can't have a home worth more than $170,000 in assessed value, and it hadn't been increased in a while. If you asked Deputy Minister of Health, I'm sure he'd tell you, my goodness, I would rather pay for a chairlift than deal with the externalities of having hospitals where half the beds are taken up by people who don't need urgent care. But that's a different department. And the different department, the social worker is evaluated on only did you get anyone into that program who didn't belong there, and if you did, you're in trouble. The Deputy Minister of Social Development is, did you overspend your budget? If he saves $2 but sends a $200,000 problem to the Deputy Minister of Health, he gets a check mark. And so a sensible system might say everyone is measured on getting these numbers down. What would you do differently? So now if I'm in admission, I might say, you know what? I'm going to look at these programs that they might qualify for, see if an exemption here would meet the policy goal. But it requires leadership saying you will be evaluated on solving this problem, not on compliance to the rules, and then you have something different. But right now, there's no reward for lowering the ALC. Look, people say they want to do it. Who in the system is rewarded for doing it? And the answer is actually nobody. But you can get yelled at immediately if you give somebody a chairlift for a program they didn't qualify for.
When it comes to the implementation of programs and services, and Kelly, you've very articulately described how the rules are irrational and often there's insufficient funds and there's little accountability.
Yeah.
What else is going on in there in that black box? What are some of the other reasons for failure?
What we don't do well is deal with problems we cannot solve with money, or at least be perceived as solving with money. Near the end of the days when I was in government, before the election when we were ushered out, I was Minister of Social Development. And my team came to me and said, so here's the projected growth in long-term care. It would take $2.1 billion to expand capacity enough to meet that over the next 10 years. And I said, not wrongly, it was the honest answer I gave. I said, I just gave blood, sweat, and tears to get $100 million for the Poverty Reduction Initiative. If it's a $2 billion fix, we don't have a fix. And that sort of ended the discussion there. What's it going to cost if we don't do it? Has anyone modeled that? And I've done that over and over. You know, I wish I'd done it because I used to ask the finance officials at budget time, well, Minister, we don't have the money for this reading program. Okay, so what is the cost 8 years from now going to be? Well, we don't know. Well, if you don't know, how do you possibly know whether you should say yes or no? And I didn't do that. And in some ways, that's the system. I don't know. We still might not have had $2 billion. But had we turned our mind to it, we might have actually planned alternate solutions, because I think somebody might have, if we turned our mind to it, said, well, half your hospitals are going to be full of patients who don't need urgent care. And so that's, I think, an example. The other one that is kind of interesting is our workforce planning is incredibly short-term as a result. In the 1990s, I use this example in the book because I worked for the hospital system then. There was a universal decision by governments in Canada to remove enrollments in largely med schools. Same thing happened in nursing and psychology to an extent. It was strictly a cost-saving measure. Without attaching a price to the service, we could still reduce costs. The same thing is what we did with doctors. Fewer doctors, fewer entry points, fewer surgeries. You slow down the rate of service. The problem is we forgot to turn the switch back so that when the problem became access, we then, and even to the point where some delayed services are costing more money in the long term, we never did that analysis. We just kept the switch on austerity rather than problem solving. As a result now, oddly enough, we've now restricted supply to the point where it is costing us more money. One, because we have a scarce service that provinces bid against each other for. You know, I remember seeing the numbers when I worked in healthcare going, so we're trying to get ER physicians into Sackville, New Brunswick, which is on the border with Nova Scotia, where the Amherst, Nova Scotia hospital is. And guess what? Every year, the hospitals just raise the hourly pay for emergency physicians because they keep going from Sackville to Amherst and cashing the checks every time they change. We bid against each other. We are overpaying for temporary solutions. And there are problems that are left to linger. I see this in psychology all the time. In our school system, we now have 23 of 28 psychology positions unfilled. Well, if you're a teacher and it takes you 3 years to get an assessment, let alone a plan for a child, chances are you're ultimately going to, not only is the human cost tremendous, but by the time you get anything assessed, the child may be throwing chairs or unmanageable or given up on school, and the solution gets more expensive. So we never did budget the cost of the shortage, and we've never really changed the orientation of human resource planning from, we still look at what can we afford rather than what do we need to do to avoid social problems.
You talk about the lack of useful data, the lack of reasonable modeling to plot these things out, to get some longer term thinking in the system. This isn't just a New Brunswick problem. This is kind of a national problem. Canada is a very poor performer in terms of the data we have, which in some ways isn't too bad, but the data we use for the purposes for which we should use it. It's almost a cultural problem there. Why do you think we don't take advantage of this information era that we're in? And secondly, are you optimistic at all that we can turn that around?
I do think, though, on data, there has been an aversion to accountability, not, I think, because people are inherently bad and trying to avoid it, but we've almost bought this sort of mantra that, well, the private sector reduces everything to outcomes. We don't. Here, we assume everyone does a good job. But it isn't, you can use data for accountability without turning it into the Glengarry Glen Ross speech that where Alec Baldwin says, yeah, first prize in sales is a car, second prize is a set of steak knives, and third prize is you're fired. You don't have to do that, but you can use it to set priorities.
What's your recommendation for those folks out there that want to make disruptive change now?
If you're on the front lines, I think one of the most important tools is to be disruptive and document. Don't fall into the trap of saying, well, I've applied the rules and gone home. If the rule is illogical, document it higher up. And that is the best thing if you're not in the management suites. I say that, early on in my job as advocate, we had a situation where there was a young person, they were going to be discharged from mental health care, and you had two different departments, each one saying we need more time, the other saying we need them out of here. And all I did was I'm just writing you an email right now. This young person is at risk if you discharge them. 2 minutes later, they advised they wouldn't be discharging them. I didn't have a magic wand, but what I did was I said, now you are accountable because if something happens, I have showed you that you knew. And making sure people know, rather than buying into the myth of, well, I'll just get yelled at, so let's follow the rule book. That's so important.
You want to change the political culture, in a lot of ways, right? This is your analysis that we don't do our politics properly, especially the execution part. You've got an office that looks both at individual cases and the panorama of the system. You use your bully pulpit remarkably and uniquely. You've been at it for 4 years. Are you moving the dial? Like when you give your talks, when you call things out, when you track accountability and what recommendations are being implemented, do you detect that there is a growing interest in making these kinds of changes and in taking a new approach to all of this?
I hope we are. And I don't know if I'd get rehired now for the job if I had to reapply. But look, Premier Higgs did appoint me, and and he never told me I couldn't say what I needed to say. The government that won the last election actually had in their platform that they would try and implement or govern in the spirit of how it all broke. And look, it's a big assignment, but We are seeing a lot of our recommendations get accepted. I think we have a more collaborative relationship now with deputy ministers who bring us in earlier. And I always say, look, I can always come and dunk on you after. I'd rather talk to you beforehand. That's happening more. Look, it's still a big culture shift, and I wouldn't expect it to happen overnight. But
have you seen anyone set a target?
So Premier Holt did, in her first few months in office, set up a dashboard with 20 indicators that her government was committed to moving, and that those were the priorities. And yeah, I think that did set a certain tone. The individual departments are getting better. I think you're starting to see deputies start to say, okay, here are the indicators we are going to use to hold people accountable. I think they could be more aggressive on the red tape reduction side in terms of giving people more discretion, but I know they're having discussions of what does that look like in everyday practice? How do we introduce, how do we train? I know the Department of Finance, unusually, I think for a social policy advocate, we have good discussions about how we can build the budget process. So even this budget process, the government did communicate and say one thing we are doing is when we evaluate reductions or saying no to things, we are actually modeling the cost of saying no so that we can plan for it. One thing about a rules-based structure is it gives you certainty in a way outcomes don't.
Exactly.
And so I think sometimes there's pushback. Middle management is, I think, where the biggest problem is. I think more and more the senior levels here are starting to go, okay, we're starting to see incentives over rules, outcomes over, over inputs, start to look at, something that I know governments do now. You see me use it in the report, ought tos and got tos. I often say, one reason everything's breaking is if you look at where the tensions are, it's these so-called got to programs. I always use healthcare this way. Whether I get preventative healthcare, whether I get a family doctor, whether I get help with nutrition, all that is discretionary. If I walk into the emergency room here at the Fredericton Hospital and say, I'm 55 and my chest hurts, there's not going to be a cabinet committee on that expenditure. It happens. If a young person doesn't get help in school, but one day winds up on the street and breaks into a store, the police and courts have to. Family courts are a have to. Welfare is a have to. The ought tos were underfunded, and now the bottlenecks are all at the programs where government can't say no. And government is starting to use that analysis now. So for instance, the Minister of Health here brought in a program and they said, emergency room visits. We've identified that the homeless population is disproportionately using emergency care and using very expensive emergency care. So what if, as a pilot, they've said, what if we created supportive housing for this population in St. John and see if the visits and the strain on the emergency care system go down? That's, to me, good logic. And so we are starting to see that introduction of reason to the New Brunswick government, and a few ministers who have become champions of that.
Where can you make the biggest difference?
Oddly enough, Stephen, I every once in a while, I can tell you, I get visits from political parties saying, gee, would you ever consider coming over here? And I always say, oddly enough, I think I have more power here because of my freedom to speak plainly. And strangely enough, the minute I gave that up for the compromises of politics, I probably wouldn't be as popular. You wouldn't want me to run. I do laugh when people say, oh my gosh, you should, maybe we need you there. Like, well, you had that 20 years ago, and I didn't notice an overpouring of gratitude. Quite the opposite.
You were ahead of your time, though.
Well, that's kind of you to say. There would be debate about that. But I think it is true that there's a kind of, in a different setting, you would call it almost, if you lose your prophetic voice, you could lose the source of your power. And I think this is right for me because I can give these diagnoses in language that maybe wouldn't be tolerated. My time in cabinet was in my 30s. Like a lot of folks, I think all of us you reach a certain age. I'm 56 now, and I always think at no time in my life have I ever looked back 3 years and thought I knew what I was doing. I always am surprised I've succeeded given how stupid I was 3 years ago. And if I could pass that on, what I'm hoping to do is shorten that learning curve for some of the folks who are there now. And I'm happy to make our office a resource for problem solving, and it's a slightly different kind of advocacy, but I intend to do it as long as my term is here, unless they send me home. And I do find that there is genuine interest in doing better. And so there are days I go home angry when I see another file but I haven't lost that sense of hope, and I meet enough people who are curious and mean it for the right reasons that I still think it can get better. One way or another, we always have.
Well, thank you, Kelly. You do give me hope, and I'm a lot older than you. We need more of you. Thank you for what you do, what you've done. Thank you for this analysis. Thank you for sharing your experiences. It's been a delight.
Well, it's a pleasure, and I am equally a fan of what you've written, and I've learned from you over my years in healthcare. So it's been lovely to meet you all and to get a chance to chat face to face.